Hello, hello. Hello, hello. So, okay, everyone. Hope all of you are doing fine. With that, welcome to microbiology doubt solving session. Okay, welcome Sunil and welcome Nasira, then Piyush, then Lahari. So let's begin with our doubt solving session. So most commonly, I got two doubts. Sir, how to remember donning, doffing PPE kit sequence with outer and inner gloves. See, first of all, outer and inner gloves donning and doffing, if you try to remember, you will get confused and you will forget the donning and doffing sequence of the essential ppe. So the four essential ppe, no need to remember the non-essential ppe donning and doffing method. Sir, kindly teach the virus classification mnemonics. So virus classification mnemonics we have already discussed in virus classification. So virus classification that itself takes 1 to 1.5 hour, 1 to 1.5 hour. That is not what we discuss here. If you have any doubts, you can ask. Right? Virus classification, it's a very big topic. If it start discussing the mnemonics of virus classification, it takes 1.5 hours for me minimum. Sir, your teaching is good. You are the best teacher. Thank you, Anil Chauhan. Virus classification once, please. Once again, I'm telling you, virus classification we can't take in this doubt solving session. That is like a class which takes time, which we don't have. Sir, what kind of immunity is FFP of post-COVID exposure patient given to new COVID patient? Fresh frozen plasma, if you are giving, you are directly giving the antibodies which are already formed in the plasma. What type of immunity if you give directly antibodies? Directly antibodies entering into our body. First of all, antibodies are there. It is acquired immunity. It is not innate. Antigen is entering, antibodies are formed. Active acquired immunity. Directly antibodies are entering into our body, passive acquired immunity. Therefore, taking fresh frozen plasma is injecting the antibodies which are formed in the plasma. So antibodies are directly entering into our body. So it is an example for passive acquired immunity. The gap between all live vaccines is 4 weeks or for some specific vaccines. If you talk about live vaccines, so if you have to repeat the live vaccines, any live vaccine you take, if you have to repeat, then the minimum gap is 4 weeks, right? Then the minimum gap is 4 weeks. And the question of yours is whether it is only for specific vaccine or for all live vaccines. Answer is for all live vaccines. Any live vaccine if you have to take, and if you have to repeat the same live vaccine because if it is having more than one doses, so obviously the minimum gap should be 4 weeks. Let it be any live vaccine. For all the live vaccines, minimum gap should be 4 weeks if you are repeating the vaccine. Sir, what's the use of NSAIDs and steroids in coronavirus affected patients, which should be used in chronic infection, which are used in the chronic infection? First of all, coronavirus infection. If you talk about coronavirus infection, right? So no antivirals are approved so far. That means we don't have treatment for coronavirus. We don't have antiviral drugs. Sir, we have tried many antiviral drugs to treat coronavirus infection, but we have not seen any good results with the antivirals. That means all these antivirals that didn't work in coronavirus infection. For now, we don't have any approved antiviral to treat coronavirus infection. In such a case, we can say there is no specific coronavirus treatment for coronavirus. See, if you take viruses, usually viruses we don't have treatment. We don't have treatment. We don't have antiviral drugs. Take bacteria, we have antibacterial drugs. Fungi, antifungal drugs. Parasite, we have antiparasitic drugs. So almost all the bacteria, viruses, fungi, though there are exceptions, but almost all of them they have good treatment. But viruses, Sir, only 4 viruses have treatment. 2 DNA viruses and 2 RNA viruses. 2 DNA viruses are hepatitis and herpes. Among the hepatitis, it is hepatitis B and hepatitis C. So these are the 2 hepatitis viruses which have treatment. So hepatitis and herpes. So these are the 2 DNA viruses which are having treatment, and HIV and influenza virus. These are the 2 RNA viruses which have treatment. They have antivirals, good effective antivirals. All other viruses, they don't have treatment. We don't have antivirals. That's why prevention is the cure in viral infection. Prevention is the cure. That's why vaccines play a very important role in viral infection, because prevention is the cure, because we don't have antivirals. So in coronavirus infection, we don't have antiviral treatment. So what to do? Sir, to reduce the severity of the infection, we reduce the inflammation. The inflammation is directly proportional to the severity of disease. If there is an infection, there is inflammation. Whenever there is infection, there is inflammation. And severity of inflammation is directly proportional to severity of the disease. So if you use anti-inflammatory drugs, they reduces the inflammation. That's how the severity of the disease is reduced. But we are not doing any treatment to inhibit the virus. We are not doing any treatment, or we are not taking any treatment which is acting on virus or which is inhibiting the virus replication. So whatever we are using is anti-inflammatory drugs. Whatever we are using, those are anti-inflammatory drugs. Anti-inflammatory drugs which reduces the inflammation. Inflammation is reduced, severity of the disease is reduced. Corticosteroids are the best anti-inflammatory drugs. NSAIDs, they are also anti-inflammatory drugs. Right? Interleukin 6 inhibitors like tocilizumab and sarilumab, they are the anti-inflammatory drugs. So whatever drugs we use, all are anti-inflammatory drugs. They reduces the inflammation. That's how the severity of the disease is reduced. If the severity is reduced, obviously the mortality is reduced. Hope you got the answer. So what are the important topics in micro? Sir, can you explain STD organisms causing it and kids treatment? Okay, what is the difference between MAC ELISA and why we use MAC ELISA for viruses? The MAC ELISA means MAC means what? IgM antibody. M means IgM antibody. IgM, A for antibody, C for capture. So IgM antibody capture ELISA. So in this test, we are detecting the IgM. That's it. We are detecting the IgM antibody, and this IgM antibody we are capturing by using another 2 antibodies and 1 antigen. So we are not going into the depth of the procedure. Sir, IgM capture ELISA is one type of ELISA in which we detect IgM. That's it. Can we use IgM capture ELISA for all the viruses and for all other bacteria? Answer is yes. Yes, IgM capture ELISA can be used for any virus and for any bacteria. But at present, IgM capture ELISA is available only for dengue virus, right? Chikungunya virus, dengue virus, chikungunya virus, and one more virus is Japanese encephalitis virus. That's it. IgM capture ELISA, so far it is available only for chikungunya, Japanese encephalitis, right? Chikungunya, Japanese encephalitis, and dengue virus. It is developed by National Institute of Virology, Pune. If you develop IgM capture ELISA for other viruses, yes, you can develop, and that will be in the market and you can detect. So there is nothing special about IgM capture ELISA. It is just a different type of ELISA, or you can say the procedure is different. That's it. Otherwise, the principle is same. It is ELISA and it detects IgM. Only the steps are different in which we detect the IgM antibody. Sir, why only for these viruses? Because only for those viruses IgM detection, capture IgM ELISA detection kits are available. For other viruses, so far it is not available because we have not developed. If you develop, you can detect. Sir, most important topics in micro, I will answer for that question. Sir, most important topics in micro, first of all, if you take entire microbiology, right? First of all, if you take entire microbiology, sir, parasitic infection, parasitic, fungal, and viral infections are very, very important. Sir, why these are very, very important? Because these are highly scoring. I'm not telling bacterial infections are not important. Actually, we are familiar with the bacteria and bacterial infections more than parasitic, viral, and fungal infections. But remember, what is important ultimately? Sir, ultimately, which topic brings us the more score in the university exam and also in the entrance exam, right? What is important is ultimately the score is important for us. If you talk about scoring per se, the parasitic, fungal, and viral infections are more important if you take in the entire microbiology. After that, so there are two diseases: PML, progressive multifocal leukoencephalopathy. Progressive multifocal leukoencephalopathy caused by JC virus, that is John Cunningham virus. And there is one more disease, SSPE, sir, subacute sclerosing panencephalitis, which is a late complication of measles virus. So these two diseases are highly important, highly important. So other than that, all the vector transmitted diseases, vector transmitted diseases. Sir, we have vector transmitting bacterial diseases, viral diseases, right? Bacterial diseases, viral diseases, and parasitic diseases. We don't have vector transmitted fungal diseases. The vector based transmission we see in bacterial, viral. So in whichever disease you see vector based transmission, there is a vector, like mosquito is there transmitting the disease, culex is there transmitting the disease, tick is there transmitting the disease. All these diseases are very, very important. So then next, the clinical syndromes. Clinical syndromes, these are very, very important. Clinical syndromes, so clinical syndromes means what? So clinical syndromes means meningitis, a very, very important topic for entrance examination. Then infective endocarditis from central nervous system, it is meningitis, or you can say meningitis or encephalitis. From cardiovascular systems are infective endocarditis or rheumatic fever, rheumatic fever. So from respiratory system, pneumonia. From respiratory system, pneumonia. From gastrointestinal system, food poisoning, food poisoning. Then from genitourinary tract, sir, from genitourinary tract, urethritis, urethritis, vaginitis, vaginitis, and genital ulcerative diseases, genital ulcerative diseases, right? From skin and soft tissue infection, we don't have any specific clinical syndrome like disease. So these are the topics which are highly important, right, for university examination and even for entrance examination, right? In the entire microbiology, if you take all parasitic, fungal, and viral infections are highly scoring. That's why they are more important. PML and SSP, these two diseases are very, very important. Must read and go. All the vector-based transmitted diseases, transmitting diseases, bacterial, viral, and parasitic, very, very important. The clinical syndromes like meningitis and encephalitis. From central nervous system, infective endocarditis and rheumatic fever. From cardiovascular system, pneumonia. From respiratory system, food poisoning. From gastrointestinal system, then urethritis, vaginitis, and genital ulcerative diseases from genitourinary tract system. These are highly, highly important, must read and go topics. Yeah, other than that, one more topic which I forgot, sir, hospital infection control, right? Hospital infection control, sir, what and all we need to read in hospital infection control, sir? Four topics. First one is hand hygiene. You need to read hand hygiene. Okay, then coming to the PPE, personal protective equipment, donning and doffing of PPE. Then BMW, sir, BMW means biomedical waste management, biomedical waste management. And the lastly, sir, sterilization and disinfection. Yeah, so these are the highly important topics, highly, highly, highly important, must read and go topics. These are the topics in the entire microbiology. So coming to the next question, sir, what is the difference between shape and symmetry of the virus? Shape of the virus is, shape of the virus is, if you take enveloped virus, if you take enveloped virus, right? Now shape of the envelope will decide the shape of the virus. If you take non-enveloped virus, if you take non-enveloped virus, it is the shape of the capsid which decides the shape of the virus. So here capsid, right? Capsid shape is the virus shape. Capsid shape is the virus shape because they don't have envelope. The outermost layer is capsid. The outermost layer is capsid. If you talk about enveloped viruses, the outermost layer is envelope. Envelope. But based on the envelope, envelope is just surrounding the capsid. So here envelope shape. Okay, take envelope shape. So envelope shape is the virus shape here. Virus shape here. Now coming to the capsid. Sir, capsid, we have three types, three shapes of capsid. So we have three shapes of capsid. One is this shape of capsid. We call it as icosahedral symmetry. Shape of the capsid is known as symmetry. Shape of the capsid is known as symmetry. So this is icosahedral symmetry. Sir, another shape of the capsid is this complex shape, complex symmetry. Another shape is this helical shape, helical symmetry. So those viruses which are having this type of capsid, they are icosahedral in shape because the capsid is the outermost layer and capsid in this shape. Complex symmetry, they are complex in shape. They are helical in symmetry, they are helical in shape. They are helical in shape if they are non-enveloped. Sir, if they are enveloped, it is based on the shape of the envelope. And shape of the envelope, we don't have any specific shape. We don't have any specific shape. For example, few viruses have bullet shape, rhabdoviruses, bullet shape virus. Few viruses are filamentous, Ebola viruses. So it is based on the shape of the envelope, right? So that is the difference between shape of the virus and shape of the capsid. Shape of the capsid is symmetry, and shape of the capsid is equal to shape of the virus in only non-enveloped viruses. So symmetry is equal to shape of the virus in non-enveloped viruses, where symmetry is not equal to shape of the virus in enveloped viruses. Okay, coming to the next. Sir, when will be your live classes? Excited for that in my city, Lucknow. So still, obviously, I'm sure I will come to Lucknow. There is no doubt in that. But still, I have not got a date for Lucknow. When I will get the date, I will let you know. So next, sir, apart from power course, class notes, anything else should we be knowing? See, as much as you read, obviously it will benefit. Right? As much as you read, that much you will be get benefited. But if you have attended my power course, I'm telling you, that is not just enough, that is more than enough. Compared to my live class, which is for 5 days, power course which I take only for 2 to 2.5 days, the power course notes is not just enough, it is more than enough. If you have attended my power course, stick to the power course notes. Take out time, if you have time, take out that time to read other subjects. Just stick to power class notes and no need to read anything extra. Don't worry. So typical and atypical pneumonia, sequence of serum markers in hepatitis B. We talk about sequence of serum markers in hepatitis B. So obviously the first one to detect is antigen, that is HBs AG, and then anti-HBC. You will detect anti-HBC, and after that you will detect anti-HBs and anti-HBE. Right? First you will get HBs AG, then anti-HBC, and then anti-HBs and anti-HBE. This is the sequence. So what about HBE antigen? HBE antigen, HBE antigen you will get only if the virus is multiplying. If the virus is multiplying, you can't detect. If the virus is not multiplying, you can't detect. Sir, HBC antigen, it is not detectable in the blood. So we have 3 antigens and we have 3 antibodies. Right, 3 antigens: S antigen, E antigen, and C antigen. Respective antibodies: S antibody, C antibody, and E antibody. The E antigen, it appears only when the virus is multiplying. C antigen is not detectable, so only S antigen is detectable, and that is the first antigen which is detectable. Then coming to the antibodies, first antibody which is detectable is anti-HBC. After that, anti-HBs and anti-HBE. These are the antibodies which are detectable. Sir, we have studied, sir, atypical pneumonia. Okay, fine. Again, that is not the doubt. That is the topic which you have to discuss. Atypical pneumonia. So not now, not now. Okay, we have to compare typical and atypical pneumonia. Might be next time or in the class. In the class, if you have attended my class, I would have discussed. If you have not attended, you, I think, have patience and wait till you attend my class to know about typical and atypical pneumonia. Sir, I have studied the whole course once and now I am scoring 300 marks. This is my first attempt. For the next 2 months, should I revise the subjects or go for YBTTPs? If you are scoring 300 marks and if you have studied entire thing, that means you have studied, your score is not satisfactory, 300 marks. So what to do is you have to revise the subjects better, especially the core subjects, that is the 9 subjects. Right? You can watch my recent NKP. Right, recent NKP in YouTube, in my YouTube channel, you can watch the recent NKP, that is the recent revision schedule. Right, in that first 9 subjects are the core subjects. If you prepare them, revise them properly, I can sure your marks will increase. right? I am sure that your marks will increase. Your marks will increase. So try to revise the notes better, especially the 9 subjects which are the core subjects. And how to revise, how to move ahead, you can watch the video in my YouTube channel. Recent video, the latest one. Sir, how to write the answers in the university exams for lab diagnosis of the virus? Okay, I don't know. I think this. Okay, fine. So lab diagnosis of the virus. If you have asked, I will answer. See, once you talk about the lab diagnosis of, you have to collect sample collection. You have to collect the sample. Sample is most of the times it is blood. Sample most of the times it is blood, and obviously based on the symptom. If it is pneumonia, collect the sputum sample. Right? If it is diarrhea, collect the stool sample. Right? If it is meningitis, collect the CSF sample. If it is urinary tract infection, collect the urine sample. Collect the sample. So after that, you need to do the microscopy. Sir, in the microscopy, right, in the microscopy, sir, viruses are not visible because no, viruses are not visible in the microscope except electron microscope because they are very small. So when they are very small, how to detect the viruses? Do the direct immunofluorescence test. What is this? Right? If you attend my class, you will get the detail what is direct immunofluorescence test. Sir, in this we can detect the antigen by using an antibody attached to a fluorescent dye. Even if the virus is small and if they are not visible, but you can detect them by using antibody attached to a fluorescent dye. So direct immunofluorescence we do in microscopy. Sir, here we are detecting the antigen by using an antibody. Sir, it is a immunological test. Yes, it is a immunological test, but ultimately we are using the stains, fluorescent stains, and we have to see under a microscope. So staining is also done, microscope is also used. So it is a microscopic method also. It is a immunological method, it is also a microscopic method. Usually we place under microscopic method, and this is most commonly method for detection of viruses or for detection of all the viruses, microscopic method. Then if you come to culture, sir, culture, we know that usually we use tissue culture. Among the tissue culture, we use cell culture. In the cell culture, most commonly we use vero cell lines. Vero cell lines. But we have different cell lines for different viruses. So do we need to remember? Answer is no need to remember. If you remember, it is better, no doubt in that. But there is no need to remember. You can write tissue culture, cell culture, vero cell lines are used. Then after that, after the culture, coming to the culture identification. Culture identification. Sir, culture identification, again, it is done either by PCR or by direct immunofluorescence test. By doing the PCR, detect the gene in the tissue culture. That's how we identify the virus. Otherwise, do direct immunofluorescence with the culture and identify the virus. So this is about the how we identify. And in the last, sir, we do molecular method. Take the sample and directly detect the gene by PCR. Otherwise, immunological method. Detect the antigen or antibody. Detect either antigen or antibody by using ELISA or rapid test. By using ELISA or rapid test. This is the lab diagnosis for all the viruses. Obviously, the sample collection vary based on the disease. Microscopic method will remain same. The tissue culture cell lines will vary. If you know, you can write. If you don't know, write the vero cell culture because that is the most commonly used. The culture identification, molecular methods, and immunological methods, they remain same. There is no much, or you can see a major difference in the lab diagnosis virus to viruses. So that's why lab diagnosis is not that much important for entrance examination because we don't have any specific points like how we get in bacteriology lab diagnosis and mycology lab diagnosis and parasitology lab diagnosis. We don't have any specific points, or morphological diagnosis is very difficult in for viruses. So anyways, you have asked, I have explained. Sir, what is the lab diagnosis of otitis media? See, lab diagnosis of otitis media, we don't have any specific diagnostic method for diseases. The otitis media most commonly caused by bacteria, and second most common cause of otitis media is viruses. Bacteria are most common, viruses are most common. The lab diagnosis is based on bacterial diagnosis and viral diagnosis. Right? If it is bacteria, you have to identify bacteria by these methods. Other viruses you can identify by these methods. There is power course LMRP. See, power course and LMRP last minute revision program. Yes, that is there in the eGurukul. Power course is direct face-to-face class, otherwise live class. It is not the recorded class. Power course is not the recorded class. It is face-to-face class, otherwise live class, right? And if you have attended my LMRP, if you tell, sir, is LMRP is enough? Yes, LMRP is enough. But the thing is, if you have attended a face-to-face class, then you will see the difference between the recorded class and face-to-face class. Face-to-face classes are always better than live classes, and live classes are always better than recorded classes. Remember this point, very important. Face-to-face classes are always better than live classes, and live classes are always better than recorded classes in the app. It is based on the interaction what you have and the understanding what you get. Otherwise, explanation is same faculty is taking the class, but face-to-face interaction is somewhat different. Somewhat different. If you ask me, sir, which method of preparation I have to opt, whether I have to go for face-to-face classes or live classes or recorded classes in the app, I suggest you go for face-to-face classes. If not possible, okay, go for live classes. Not possible, okay, go for recorded classes in the app. I'm not telling no to recorded classes or live classes. I'm telling face-to-face class are better than live classes are better than recorded classes in the app, right? Recorded classes, any method, whatever method. If you find no, sir, recorded classes in the app, I find it better to follow, then obviously you can follow. It is based on you. Sir, then, okay, sir, thank you so much. Killing of intracellular pathogen, extracellular pathogens, I am confused. Nothing to get confused there. This is a cell, just consider this is a cell. Our cell, maybe neutrophil or macrophage, whatever it is, our cell, it is our cell. Intracellular organisms, they multiply inside the cell. Extracellular organism, they multiply outside the cell. So this is the organism. The organisms are having antigens. Organisms are having antigens. When these organisms enter into our body, a few of them they multiply inside the cell, they're intracellular organism. Few of them multiply outside the cell, they're extracellular organism. So whenever they have entered, our immune system produces antibodies. Our immune system produces antibodies. So when these antibodies are formed, so these antibodies, they will bind to the antigens, they neutralize them and they inhibit them. That's why antibodies, they inhibit the organisms. So antibodies can easily bind to extracellular organisms, but antibodies, right, they cannot bind to intracellular organisms, because if they have to bind to intracellular organisms, they have to enter the cell. But antibodies, they can't enter the cell. Antibodies, they can't enter the cell. So antibodies, they act mainly against extracellular organisms, the organisms which multiply outside the cell. They can't act against intracellular organisms because they are inside the cell, and our antibodies, they cannot enter inside the cell. So then how to inhibit intracellular organisms? The only way how you can inhibit intracellular organism is kill the intracellular organisms, inhibit the intracellular organisms along with the cell in which they are present inside. So this cell is our cell. Organisms have entered, they are entering inside our cell and they are multiplying inside our cell. Our immune system, it destroy our own cell containing the intracellular organism. Cell is also destroyed, along with the cell, organisms are also destroyed. So who will destroy the cell? This cell along with the intracellular organisms destroyed by, sir, cytotoxic cells. Cytotoxic cells. Sir, which are the cytotoxic cells? One is CD8 T cells. CD8 T cells are cytotoxic cells. Sir, NK cells are cytotoxic cells. NK cells are cytotoxic cells. So CD8 T cells, NK cells, what they do? They destroy the entire cell containing the intracellular organisms. So when the cells are destroying the organism, intracellular organism, right? When the cells are destroying the intracellular organism, this immunity we call it as cell mediated immunity, because immunity is mediated by cells. Which cells? CD8 cells and NK cells. They are killing the intracellular organisms along with the entire cell. They are cytotoxic cell, toxic to the cells. So they destroy the cell along with the intracellular organisms. So when antibody is killing the antigen, then we call it as antibody mediated immunity. So immunity mediated by antibody. This antibody mediated immunity is also known as humoral immunity. Right? Two types of acquired immunity. So what are the two types of acquired immunity? Cell mediated immunity and antibody mediated immunity. Cell mediated immunity is the major immunity against intracellular organisms. The cell mediated immunity is not required against extracellular organisms. Why? To kill the cell. when the antigens are already outside. So cell mediated immunity, it will not act, right? If the antigens are extracellular, so extracellular antibody mediated immunity will act. If the cells are intracellular antibodies, they cannot enter inside the cell. So that's why cell mediated immunity will act. Hope you have understood. So that's why cell mediated immunity is the major immunity against intracellular organisms, and antibody mediated immunity or humoral mediated immunity is the major immunity against extracellular organisms. So what is slide culture for fungi? Okay. No need to go in depth. What is slide culture? So slide culture is nothing but a special culture to see the fungi better in LPCB. Slide culture is a special culture in which you can see the fungi better. See, we do culture SDA culture. After doing the culture of fungi on SDA, we take the fungi, we do LPCB staining, and we see the fungi, we identify the fungi. Sometimes we may not able to identify the fungi if you can't see them better. Then what to do? So do the slide culture, grow them in the slide culture, and then take them and look under the LPCB, then you can see them better. So slide culture increases the morphological appearance of fungi. Now you can see them better, you can identify them better. Procedure of slide culture and all, you will get it in the textbook. This is not the time to explain, right? So you can see fungi better if you grow by slide culture technique than SDA. That's it. Which is the most common type of neurocysticercosis, subarachnoid or parenchymal? See, there are few studies which say subarachnoid, right? If you talk about neurocysticercosis, there are few studies which say subarachnoid, and there are few studies which say parenchymal. Now, if you say subarachnoid, sir, we have the source to show subarachnoid is most common source. If you say parenchymal is most common, then obviously we have the studies which say parenchymal is more common. So based on my observation and based on the sources or the articles whatever I have collected, and based on my experience in neurology, is a parenchymal is most common. Parenchymal is most common, and you can't say whoever say subarachnoid they are wrong, and whoever say parenchymal they are wrong. Now there are studies which saying subarachnoid is also more common. When you see the studies saying parenchymal is also more common, so now being students, what to do now? Which one to opt for the entrance examination, right? It is based on examiner mentality, whatever examiner is following. But according to me and my study and my observation and whatever the research I have done regarding the most common site of neurocysticercosis, I have asked many people who are working in neurocysticercosis. So I have got the answer, parenchymal is most common. That's why I stick to parenchymal. Which is most sensitive and most specific test for syphilis? The most sensitive, you're talking about most sensitive, always screening tests are most sensitive. Screening tests are always most sensitive. If you talk about most specific, confirmatory tests are most specific. Always remember, confirmatory tests are more specific. Always. Any diseases in which if you have screening test and confirmatory tests, screening tests are most sensitive, confirmatory tests are most specific. Sir, if you ask most sensitive plus most specific, both most sensitive plus most specific test, both, then those tests what we call as gold standard tests. Gold standard tests are most sensitive plus most specific. So most sensitive test is the screening test, most specific test is the confirmatory test, most sensitive plus most specific test is the gold standard test. If you talk about the syphilis, the most sensitive. Sir, if you talk about screening test, we have non-treponemal test, VDRL, RPR, trust, we have many tests. The VDRL will become the most sensitive among the screening test. The confirmatory test, we have FTA, ABS, right? We have TPHA, we have TPI. So we have many tests in the confirmatory which are most specific, Then we say FTA, ABS is the most specific. So if you talk about gold standard, FTA-ABS, which is the most specific, right? It is not only most specific, it is also the most specific plus most sensitive. Now, if you just consider sensitive, just sensitive, so now VDRL and FTA-ABS, which is most sensitive, then VDRL is most sensitive. Compared to FTA-ABS, VDRL is most sensitive. But most sensitive plus most specific is FTA-ABS because VDRL is having less specificity. VDRL is having less specificity. So this is the answer for syphilis. The most common causing chirion is mentagrophytes or verrucosum. Okay, because you have asked, I will tell. If you talk about the chirion, most common organism is Trichophyton verrucosum, no doubt in that. The second most common cause is Trichophyton mentagrophytes. The second most common cause is Trichophyton mentagrophytes. Where you should not get confused is hair perforation test. Hair perforation test. Right? We are talking about dermatophytes. Hair perforation test positive. Most commonly by Trichophyton mentagrophytes. Most commonly by Trichophyton mentagrophytes, and the second most common is Microsporum canis. My Trichophyton mentagrophytes, most common, you see only in one place, hair perforation test. In dermatophyte infection, Trichophyton mentagrophytes is the second most common. It is not the most common in any. It is not the most common in chirion, not in Favus, not in Ectothrix, not in Endothrix, not in any Tinea capitis or Tinea cruris or Tinea pedis, Tinea corporis. So it is not the most common. It is always the second most common. But in hair perforation test, it is the most common, giving the hair perforation test positive. Peace and blessings to my brother. My God, are you all? Okay, thank you very much for the blessings. Okay, doubts please, blessings later. Sir, your Telegram group link please. Okay, I will share my Telegram group link here. Sir, after how many days of COVID infection live attenuated vaccines can be given? Is the question asking for duration of humoral immunity? Thanks in advance. Sir, after how many days of COVID infection live attenuated vaccines can be given? See, first of all, during the infection, during any infection, we avoid live vaccines. During any infection, we avoid live vaccine. After infection, sir, once patient got recovered, you can give vaccine anytime you want. You can give vaccine anytime you want if it is mandatory. Otherwise, it is better to give 4 weeks gap. See, wherever live vaccines come, 4 weeks gap. But here, post-COVID, it is not mandatory to take 4 weeks gap. The vaccines are mandatory. Right? If you have to take immediately in an emergency, take the vaccines. If not, better to wait for 4 weeks. 4 weeks. Sir, HEI and escape organisms. Some info on common HEI causing organisms, sir. It's previous year topic, sir. Okay, fine. Hospital acquired infections, right? Hospital associated infection or hospital acquired infection, again, that's a big topic. It's very difficult to discuss. So usually if you talk about HAIs, right, we have 4 important HAIs. The first one is COTI, catheter associated urinary tract infection, right? The next one is CLABSI, right? No, CLABSI is there, but okay, right, CLABSI, otherwise CRBSI, right? Line associated bloodstream infection, otherwise catheter related bloodstream infection, right? COTI, CLABSI or CRBSI. And the third one is VAP, ventilator associated pneumonia, and the fourth one is SSI, surgical site infection. So these are the 4 important hospital associated infection what you need. There are many others, but these are the ones which we use it for hospital associated infection surveillance purpose, right? Surveillance purpose means to monitor how many infections are occurring. These are the 4 important infections, hospital acquired infection, you can say catheter associated infections we use for surveillance purpose, that which you need to know. If you talk about most common organisms, right, depending on the, again, infection, the most common organism varies. Depending on the infection, the most common organism varies, and we have different studies telling different organisms as most common. Different studies telling different organisms as more common. For example, if you take, sir, most of the studies say E. coli is more common for urinary tract infection. Once again, I'm telling you, most of the studies. You may get few studies telling Klebsiella is more common, but most of the studies say E. coli is more common. Sir, if you talk about Klebsiella or CRBSI, sir, earlier studies they were telling cons, they are more common. There are few studies telling Staph aureus is more common. Staph aureus more common. But the new studies are telling, sir, gram negative, non-fermenting bacilli are more common. That means, sir, pseudomonas, and right, Acinetobacter. So these about the new studies. So new studies say pseudomonas and Acinetobacter are more common, but earlier studies they were telling cons were the one which were more common. Cons. Right? There are few studies telling Klebsiella is more common. Right? These are the new studies. Earlier they were telling gram positive like cons and Staph aureus, but new studies telling gram negative. The VAP, there is no doubt in that Pseudomonas and Acinetobacter are more common. Pseudomonas and Acinetobacter are more common. If you talk about surgical site infections, cons are more common. Again, I'm telling you, based on most of the studies, you will get different organism as most common organism in different studies. Right? In most of the studies, if you take, these are the organisms which are most common. The most common neuropathy infection in post-transplant patient. See, if you talk about post-transplant patient, so usually the questions are based on nephropathy, right? So the most common infection is, that cytomegalovirus. Most common infection is cytomegalovirus. Most common infection causing nephropathy, not neuropathy, nephropathy. If they mention nephropathy, then the organism is not cytomegalovirus, then the organism is BK virus. They ask most common fungal infection, then your answer will become cryptococcus. Then the answer will become cryptococcus. So usually if they ask questions, they ask only these three questions. Most common infection is cytomegalovirus, most common infection causing nephropathy, BK virus, most common fungal infections are cryptococcus. But now coming to your question, if they ask neuropathy, what to write? Neuropathy. I'm telling you, other than nephropathy, whatever may be the clinical presentation, the pneumonia, neuropathy, whatever they ask, you have to go for cytomegalovirus. Right? Most common infection is cytomegalovirus. Whatever may be the clinical presentation. Only if they mention nephropathy, you have to go for BK virus. Fungal infection, you have to go for cryptococcus. The STD treatment kits are important. STD treatment kits are not important. Sir, is it old method and it's not asked anymore? See, if you talk about sexually transmitted diseases, urethritis is a sexually transmitted disease, and vaginitis is a sexually transmitted disease, and genital ulcerative diseases are sexually transmitted diseases. See, there are many sexually transmitted diseases, but these are very important. Urethritis, very important. Vaginitis, very important. Genital ulcerative diseases, very important. Very important. So we have to study this, the clinical presentation and all, how to differentiate and all. But particularly the treatment kits, if you ask me, they are not that important. But if it is asked in the university examination for 5 marks and all, then obviously you have to write regarding the treatment kits. You have to write. But if you just write the antibiotics and all, whatever is used, and that is more than enough. What they expect, the major marks, the major marks is for clinical presentation in these sexually transmitted diseases. Clinical presentation carries the major marks. Diagnosis, it carries less marks here, and they won't expect specific diagnosis for each and every organism. In general, you have to write the lab diagnosis. Obviously, if you talk about the treatment, you have to mention treatment, but treatment is not that important. I'm not telling not that important because it won't be carrying a major part of the marks. Major marks goes for clinical presentation. So some minor marks carried by diagnosis, treatment, it carries almost negligible marks. That's why it is not that important. No need to worry about the treatment kits. But obviously, if you know better to write in the university examination, for entrance examination, they won't ask the treatment kits. They won't ask the treatment kits. Anything else which I have missed? Sir, which condition can cause gram-positive bacteria to appear gram-negative? Right? Which condition which can cause gram-positive bacteria to appear gram-negative? Gram-positive bacteria appearing gram-negative is over decolorization. That's it. If you over decolorize it, right, gram-positive will lose its color and they will take the counter stain and they appear pink. That is gram-negative. Over decolorization. Hope these are the questions. Any other questions if I have missed, please you can repost it so that I can see them. Sir, biomedical waste management and disposal. Thought you can attend the class for that biomedical waste management and disposal. That is it is a topic which you have to study. If you have doubts, particularly sir, this material where to throw, I have doubt, then I can answer in this doubt solving session. If you want entire thing about biomedical waste management, then you have to attend the class. Right? If you have not attended, then wait for the class. Right? Anything else regarding diphtheria? I saw one question, but no. Regarding tetanus, the mnemonic for tetanus immunoglobulin vaccine need if taken within 5 years and 10 years. So very good question. For that, I want to answer right regarding the tetanus vaccination. Regarding the tetanus vaccination, so you will get confused in the books. Category A, category B, category C, category D. 4 categories we have. Then we have simple wound and other wounds. 2 types of wounds we have. See, in simple, just remember that if the patient has taken, right, if the patient have taken the complete course of vaccine, complete course of vaccine taken, complete course of vaccine is taken means what? So usually during our childhood we take the vaccine, tetanus toxin at 6 weeks, 10 weeks, 10 weeks and 14 weeks. 14 weeks. Then we repeat it in 12 to 15 months. Then we repeat it in 12 to 15 months. Then we take at 5 years, 10 years and 16 years. So totally how many doses we take? 1, 2, 3, 1, 2, 3, 1. Total 7 doses of vaccine we take. 7 doses of vaccine we take. If the patient have taken these doses, otherwise out of these doses, if the patient have taken more than 3 doses, if the patient have taken more than 3 doses, then complete course the patient have taken. More than 3 doses. Out of these 7 doses, more than 3 doses patient already taken means completely taken. Matlab course is completed. Others are boosters. Right? See, 6 weeks, 10 weeks, 14 weeks. These are the 3 doses. If the patient have taken these 3 doses, then patient have completed the course. Remaining are boosters. These are boosters. These are boosters, and these are the 3 doses. If the patient have taken the vaccine at 6 weeks, 10 weeks, and 14 weeks, patient has taken the complete course. Forget about the boosters. Patient have taken the complete course, 3 doses. Now what to do? So the patient is coming to you with a wound who has taken these 3 doses. 3 doses already taken during the childhood. Now coming with a wound, what to do? That the previous dose of tetanus is within 5 years. Within 5 years. No need to do anything. Sir, more than 5 years, give one vaccine. Give one vaccine. Tetanus toxoid. Give one vaccine. That is nothing but tetanus toxoid. Sir, more than 10 years. Previous dose, the last dose, right, taken 10 years back. 10 years back. Now got the wound. Then what to do? What to do? Obviously, give the vaccine. That is one tetanus toxoid. If the wound is contaminated and dirty, sir, contaminated or dirty wound, so then what to do? Along with the vaccine, you need to add immunoglobulin. So these are the 3 things what you need to know. The patient have taken the 3 doses at 6 weeks, 10 weeks and 14 weeks. That means patient have completed the course. Whether the patient has taken boosters or not, that is secondary. Now, once he has taken these 3 doses, see the last dose, whether the 14th week dose, otherwise the patient have taken booster. So patient have taken a booster at 16 years. 16 years. Now patient got injured at 20 years of age. So patient have taken at 16 years, now got injured at 20 years, right? How many years since the last dose of vaccine? 4 years. Patient is within 4 years since the last dose of vaccine, no need to give anything. The patient has taken 16 years ka dose. Now patient is 25 years. Patient is 25 years. How many years since the last dose? Sir, 9 years. 9 years means more than 5 years. And obviously less than 10 years. More than 5, less than 10. So give one tetanus toxoid. The patient has taken a last dose at 16 years and patient got injured at 30 years. 30 years of age. Now the age is more than 10 years. Right? Give one tetanus toxoid if the wound is not contaminated or dirty. If it is contaminated and dirty, along with the tetanus toxoid, add immunoglobulin. Sir, what if the patient has not completed the course? Inadequate course. Inadequate course. Sir, inadequate course means patient has taken the vaccine but less than 3 doses. Here more than or equal to 3 doses. Here is less than 3 doses. Patient has taken but less than 3 doses, or right, vaccination status is unknown. Patient is telling, I don't know whether I have taken the vaccine or not. I don't know whether I have taken the vaccine or not. Sir, what to do in this case? Right? What to do in this case? So in this case, sir, complete the course. Complete the course. Take the vaccine, right? Give the vaccine. Give the vaccine. Give the vaccine. What vaccine? Complete course of vaccine. Complete course of vaccine. Sir, complete course of vaccine means what? Right? Complete course of vaccine means what? So complete course of vaccine means we have to give him, right? We have to give him 4 doses. So first dose, then 4 weeks gap, 4 weeks gap, then second dose, then 1 year gap, right? Second dose, 1 year gap. After that, 6 years gap and 1 more dose. So totally we have to give 4 doses. This is the vaccination in adults who has not taken the vaccine in the childhood. Vaccination in adults who have not taken the vaccine in the childhood. So 4 doses we have to take. So first dose, then 4 weeks after first dose, 1 year after first dose, and 6 years after first dose. Totally 4 doses we have to take. Complete the course of the vaccine. Not only you should not like it's, you have to give first vaccine, but after that you have to call the patient after 4 weeks, after 1 year, and after 6 months you have to complete the course. Yes, in this case, again, if the wound is contaminated or dirty, if the wound is contaminated or dirty, then you have to add immunoglobulin. Add immunoglobulin only 1 time, not 4 times. So this is the tetanus vaccine schedule. Very simple. Category A, category B, simple wound, dirty wound, can forget about everything. Whether the patient has completed the course or not. Complete course means 3 doses, 6 weeks, 10 weeks, 14 weeks. What about remaining doses? Remaining doses are boosters. 3 doses taken, then less than 5 years. No need to do anything more than 5 years. So give 1 dose of vaccines, or more than 10 years, 1 vaccine. But if the wound is contaminated, add immunoglobulin. Not completed the course, otherwise not taken the vaccine, complete the not 1 tetanus toxin is toxide vaccine is not enough. Complete the course. You have to give 4 vaccines. And if the wound is contaminated, add immunoglobulin only once at the time of entry. Very simple, right? Simplified tetanus toxoid schedule. Like this kind of schedule you will not get in any books. Very simple and simplified, very easy to remember. Anything else? Most common organism causing croup is now streptococcus. Croup, okay, croup syndrome. Croup syndrome. Again, like I said, many sources or many articles, many studies can say streptococcus is most common causing croup syndrome, and many articles say, right, laryngotracheobronchitis, para-influenza virus can cause this croup syndrome. But most common, I think you can go with streptococcus. No, most common, I think you can go with the para-influenza virus, I'm telling you, because lower respiratory tract infection, most common, will become virus only, para-influenza virus. I'm not sure regarding this streptococcus and para-influenza virus, but still at this moment I go with para-influenza virus, but still I will see with the studies and I will get you back with my Telegram group link, right? In the Telegram group, in my Telegram group, you can join to the Telegram group. Sir, I'm requesting, sir, please clear my doubt how to remember GPB and GNV. Okay, life cycle, how to remember GPB and GNV, please attend the class. That is not a doubt. And it takes time. We don't have time. It is a doubt solving session, 1 hour session, which is already almost over, right? Almost over. So if you want how to remember, please attend the class. Attend the class. The life cycle learners blueprint, revise frequently. Yeah, right. Like Sri Lakshmi answered, revise the blueprint frequently to the life cycle. The essence regimen is asked. Most common organism causing VAP. The most common organism causing hospital infects, this hospital associated infections, very difficult to say. Very difficult to say. Very difficult to say. But most of the studies say Acinetobacter. Most of the studies say Acinetobacter is most common. But still, many studies will get Pseudomonas is more common. But if you consider most of the studies, sir, Acinetobacter is the most common. You can say that. Okay, essence regimen, rabies vaccination schedule. Again, it takes time. Essence regimen is asked. You have to remember them all. If you have attended my classes, it's very easy. We discuss usually old regimen and new regimen both, and there is no much difference between the old and new regimen. If you go with the recorded classes in the eGurukul, I have explained the new regimen of WHO in the eGurukul. So because I prefer to answer according to the new regimen in the examination, but if you have attended my live classes or face-to-face classes, there we discuss both old regimen and the new regimen both, and we discuss how to remember the old regimen and new regimen. So after first revision, how many questions we can improve according to you? See, after first revision, it is very difficult. We won't see a much improvement. First revision is just read and finish it off so that you can get familiarized with each and every topic in each and every subject. That is what is first revision. Revise and finish it off. Second revision onwards. So there is a method to revise. You just can't read and finish all the 19 subjects. Read one subject, give the fast revision. After every 3 subjects, again revise all the 3 subjects. Go to next 3 subjects, again revise those 3 subjects. Go to next 3 subjects, again revise all the 9 subjects. So in this way, you have to revise and you have to move on. So after this second revision, yes, we expect to answer almost minimum 70% of the questions after second revision. After first revision, it's very difficult to see a major improvement. You won't see a major improvement after first revision. So after first revision, whatever marks you will get, it is based on how much you have studied in your UG life. That is second year, third year MBBS life, final year MBBS. How much ever you have studied, based on that, you can see your marks after one reading and one revision. And obviously based on with how much concentration you have attended the class, the entrance classes, with how much concentration and interest, with how much of dedication you have attended the class, and how much you have read in your UG life. So based on that, you can see your marks after first reading and first revision. Major improvement what you see is after second revision, and second revision, I'm telling you, it is not just reading and finishing all the 19 subjects. That is not our goal. So here you have to make a major improvement for that. Read one reading, 3 to 4 days, one subject, and one fast revision, half an hour revision daily every day. And then after 3 subjects, again revising the 3 subjects, then moving on to the next 3 subjects, again revising, moving on to the next 3 subjects. To finish the 9 subjects, which are the core subjects according to my video, that is the recent revision plan. And then revise these 9 subjects once again, then move on to the next 10 subjects. This is how you have to go with the second revision. And as you have started the second revision, with every 3 subjects, you see a major improvement in your marks. Right? No need to wait till you finish your second round of revision. It takes a long time. With after every 3 subjects, what I suggest is give one GT. In second revision, after every 3 subjects, give one GT, grand test. In that, see that from those 3 subjects, whatever you have read, you are getting good marks. After next 3 subjects, again give the GT. Now see, from the previous 6 subjects, whatever you have studied, you are getting good marks. And after next 3 subjects, give the GT. See, from the 9 subjects, whatever you have covered so far, from those 9 subjects, you are getting good marks. So now GT to GT, your scores will increase, and your score will increase and also improve better. Right? So with that, hope I have answered almost all the questions whatever you asked. Sir, what is the basis of the beta D glucan test? No need to know the basis. Just remember, in the invasive infections, BDG is detectable in the blood. If the infection is fungal infection is not invasive, it is not detectable in the blood. Basis is not required. They won't ask in your university examination. They won't ask in your final examination. Right? With that, thank you guys. Thank you for your patience, and thanks for attending the class. And hope I have answered almost, according to me, I have answered almost more than 98% of the doubts, right? Otherwise, I can say 100%, might be I have missed 1 or 2, I don't know. But I have tried to answer almost all the questions, whatever you asked. So with that, if you are in second year, right, almost you would have finished second year, right? You have another 2 years, third year and final year. Read well. Concentrate only on third year subjects and second year subjects in third year, and final year subjects in final year. If you try to concentrate all the subjects in third year, then you can finish, but you can't thorough with the subjects, right? Being thorough with the subject is what is important, rather than finishing the subject, right? Rather than finishing the subject, you should be thorough in the subject. Thorough means what? From this subject, if I get questions, I can answer. If that confidence you have, then you are thorough in that subject. You are thorough in that subject. This is what is needed for entrance examination. Sir, I have finished the subject. If you have finished the subject, it is not going to bring a major change in your scoring. Sir, I am thorough in this subject. I have confidence. If you ask any question from this subject, sir, majority of the questions I can answer. That confidence you have in that subject, then you are thorough with that subject. So if you want to read in that way, third year and second year subjects you can do in third year. If you also include first year, then it's very difficult to get thorough with all the subjects. So in the third year, get thorough with third year and second year subjects. In the final year subjects, and then give the exam. So whatever the first year subjects, after final year, if you get time, just go through the first year subjects in 2 to 2 days, fast revision. So who are those who have those who are beginning the second year, read first year and second year subjects very well in the second year, third year subjects in the third year, final year subjects in the final year. So those who are post interns preparing for the upcoming NEET, for those people, what I can say is, whatever you have read so far, very nice. Now whatever you read, you can read based on your plan, but see to it that the 9 core subjects, according to my recent revision plan, the 9 core subjects, you should be minimum I'm telling, at least in you should be thorough with these 9 subjects class notes, whatever you have attended. Thorough. I'm not telling not to read other 10 subjects. Read other 10 subjects also. If you have time, get thorough with all the 19 subjects. Get thorough. Obviously, that is better. But when you don't have time, sir, I have not read everything. I don't have time to get thorough with all the 19 subjects. I can read all the 19 subjects, but I can't get thorough with all the 19 subjects. If I have to read like that, I need time, but I don't have time. What to do? What I say is, at least be thorough with the 9 subjects, the core subjects. Remaining subjects you can just read and finish if you have less time. If you have more time, be thorough with all the 19 subjects. So with these small tips to all the students who are in second year, third year, final year, and also in the interns, read well. My blessings are always there with you. It is just now your hard work, right, and your smart plan, how you have planned to read till your exam matters a lot. One thing I want to say, never quit till the last day of the exam. Remember this. This is the last sentence which I want to say here today. Right? Whatever maybe your situation is, how maybe your situation is very bad, worse situation. Maybe you're feeling, if I write the exam now, I am the person who will get the last rank. Otherwise, I am the person who won't get the rank. If you have that feeling, still don't think of next year, preparing next year for next year exam, this upcoming NEET, right? Whatever time is available, right, 50 days, 55 days, whatever time is available, in that, utilize those 50 to 55 days, with interest, with dedication. Put your maximum efforts, how much you can put. Plan properly. Don't divide the time equally for all the 19 subjects. Like I said, for 9 subjects give more time, the core subjects. Remaining 10 subjects you can go fast, you can go fast and finish them fast. Plan properly, put your efforts, put your hard efforts, maximum efforts, how much ever efforts you can put. Then remember this point, do not quit till the last day of the exam, right? I'm telling you, really you can do well if you follow these things. So with that guys, all the best. Thank you. Good night.